Okay, today we're going to be completing the head to toe assessment. We're going to be doing nose, mouth, and neck. I'm going to go ahead and start with your nose. Okay, nose is symmetrical and straight. There's no discharge or flaring and is uniform in color. Alright, I'm going to go ahead and feel your sinuses. Okay, there's no tenderness or lesions. I'm going to have you close one of your nostrils and blow with your mouth closed, and then do the same to the other side. Good job. Air moves freely as the client breathes. I'm going to go ahead and take a look in your nose now. Alright, the mucosa is pink, clear, and watery. There's no discharge or lesions. Nasal septum is intact and in midline. Alright, next I'm going to go ahead and move on to mouth. I'm going to take a look if that's okay. Alright, lips are pink. I'm going to ask you if you can pucker your lips like you're going to whistle. Good job. Lips are uniform pink, soft, moist, smooth. Texture is symmetrical, and client has the ability to purse lips. Okay, I'm going to go ahead and put on my gloves. Alright, I'm going to go ahead and pull your lip down if that's okay. Take a look. Going to take a look at your teeth. Going to go ahead and move your gums a little bit. Alright, the cheeks had no reaction. The tooth enamel is white, shiny, and smooth. And I'm going to go ahead and take a look at your tongue. Okay. The surface of the tongue is kind of rough. The taste buds are popped up. The tongue has a thin white coating on it. It is moist, slightly rough. Alright, now I'm going to have you go ahead and say, ah. Good job. Uvula is positioned at the midline of soft palpable rises during vocalization. Okay, I'm going to go ahead and have you tilt your head back. Alright. The orthopharynx is pink, smooth, and positioned and posterior to the wall. Tonsils are pink, smooth, with no discharge. They are grade 1. Now I'm going to go ahead and feel your neck. Skin is pink, warm, and soft to the touch. It's dry. I'm going to have you do some movements for me. So can you put your head to your chest, your head back. Good job. Ear to shoulder and chin to shoulder. Good job. Okay, now I'm going to go ahead and have you push against my hand with your head, and then push your shoulders up. Alright, strength is equal. Now I'm going to go ahead and feel all your lymph nodes. So we got the occipital, postoccipitable, preocular, submandible, submental, superficial anterior cervical, inferior anterior cervical, and supravascular. Alright. Lymph nodes are not papillable, not enlarged, and they are not tender. I'm going to go ahead and move my fingers along your throat to feel your trachea. Okay, the placement is in the middle of the neck. Spaces are equal on both sides. And I'm going to go ahead and touch and listen to your carotid. Good job. Feel this side. Okay, and I'm going to go ahead and take a listen. Sit. And carotids have no sounds for Bruin.